Hey, this is Eric. That's like I'm streaming here. I just need to make sure I am streaming to the right platform. Yeah, looks like we're streaming to what is healthcare. All right, well, this works. Double check, make sure we're good to go. And then I will proceed. Give me 1 second here. Yeah, there, sure enough, there it is. Excellent. Well, this is going to work, I think, very well. Make sure I have my audio going. Let's see, is that working here? Testing, testing. Is it going on here? Yeah. Okay. This is great. Well, as with anything new, there's always going to be hiccups and mistakes and who knows what else. But I just want to start getting used to this, be more comfortable with this idea of streaming or sharing information regarding to what is HealthShare and HealthShare solution and what is a HealthShare all in just in general, and some of the other clients and customers and wonderful people that I work with. For example, in the background, I have here Gold Care, health and or health and wellness, and so you'll want to look into that as well. That's another great resource for freedom fighting doctors. But today I'm just going to focus on HealthShare and what it is, how it works, how you can participate in it, how easy it is to participate in, and so forth. And maybe you give some examples, personal examples of how I use it, and maybe some other stories as well. But again, to start off, my name is Eric, last name Baird, and I have been doing HealthShare since 2019. I've been a member of HealthShare since then. It's been a wonderful tool, to manage our healthcare and the services that we like to partake in as far as, any sort of major medical or preventive services and things like that. So I've been doing it for a while and have helped lots and lots and lots of families find better care through joining a health share, definitely saving lots of money by being a member of a health share. And so let's proceed. We'll go through the details, and then if you have any questions, you can always get a hold of me. I do have a website at whatishealthcare.com, or you can look it up at whatishealthshare.com, and either of those point to the same website, and then you can find a scheduled call with me link there, and I'm happy to walk you through any questions you might have so about your situation. So, all right, so to start off, so what is the number one problem with today's healthcare, right? A lot of people are tired of paying very high premiums. And if you're in 2026 and you renewed for 2026 with insurance, you know exactly what I'm talking about. The premiums have jumped significantly over the last few years, especially this year because subsidies have been removed. If there are still some subsidies, then you're lucky. Count yourself lucky that you've got it. But you still have deductibles, and deductibles are high. Sometimes they're $10,000 per family, or $5,000 for an individual. And what that means is you have to pay that first amount before the insurance will pay out. Networks, I think they're broken in the sense that you have good doctors and bad doctors all in the same network. And so when you go looking for a doctor, you kind of close your eyes and point at a name on a page and start calling around or whatever. You don't know really what's going to work, or who's a really good doctor or specialist to go to. So there are other resources to find that out, and we don't have networks at HealthShare, so you can go wherever you like. Uh, and then there's the issue of claims and denials and delays, the claims game. Some people say, what really gets me is, when you have an insurance company that's making billions of dollars in profit and executives who are making millions of dollars in salary, it kind of it doesn't look good. It doesn't bode well for that insurance company to say, hey, yeah, we've got millions of dollars in profit. Makes you wonder, like, well, who's not getting helped? Who's not getting served by all of that money that should be there to help people with their medical expenses, medical needs? And the last thing, employers and employees are feeling the squeeze, right? Financially, it's expensive. And it's not getting any easier, right, for them. So if you are an employer, I do have other services that would incorporate health sharing for your employees that are and can be more affordable for you and for them. I've got great examples of other companies who are using it with 200 plus employees, and they like that model. It's saving lots of money and they're building their own funds. So that's something to think about. So the alternative, right? So I'm proposing an alternative. And that alternative is something that has existed for 50 plus years, called health sharing, also known as Christian healthcare ministries or community share programs, things like that. But what is a health share? A health share is basically just a nonprofit community that shares major medical expenses directly without insurance being involved, right? And why is health share a benefit? Well, or better, it's lower costs, it's flexible, and it's community driven versus board member or profit driven. So it's important to understand what HealthShare is not. So let's talk about that real quick and get that out of the way. So HealthShare is not an insurance company. And I know this looks like what HealthShare is not. It's not a double negative, I promise. It's just not insurance. Um, and so it's not an insurance company. It doesn't have the same contractual agreements as an insurance company does. It's not guaranteed contractually either, and it has no oversight or regulation from federal or states agencies to make sure that it's doing what it says it's doing, like insurance companies. Insurance companies have these agreements and these contracts, and that's what makes them insurance companies. HealthShare is not an insurance company, so those agreements don't exist, right? Now, some people say, well, what are they going to do? Are they going to pay? Are they going to help? The answer is yes, they are going to help still, and it does have a very good track record of and history of paying members' medical needs. And I have a lot of examples too. It's not ACA compliant by itself. So ACA is the Affordable Care Act. If you didn't know, ACA has been removed since Trump's first presidency. That was removed. There's no mandate for you to have health insurance, right? So unless, and there's a caveat there, unless you're in one of several states that still have a state version of that mandate. So California is one of those states, New Jersey, Massachusetts, and I think DC, and there's maybe even, well, I think that's all. And there's a few others actually, but you can easily, look that up on ChatGPT, or you would know because if you're when you're filing your taxes and you're asked for a specific health insurance statement, then that's you're in one of those states, right? And so uh, this does not meet that requirement for your state. So if you're in one of those states, there are other alternatives that you can select to get around the penalties. And I'm not telling you to avoid, or lying or anything like that. But if you are of a particular faith and you want to put yourself as, hey, this is a faith statement that I don't do that, or there some of the exceptions are even being members of HealthShare. So if you're a member of HealthShare, you can even say, yeah, I'm a member of HealthShare, and that's a clear exception that you can check on that box to not get penalized, right? Now, HealthShare is not, as I mentioned, guaranteed or contracted, right? So there's no guarantee or contract. And then it's also the contributions because health shares or programs and the companies associated with them are nonprofit organizations. There is no tax deduction because you're a member, so you're technically the beneficiary. If you are contributing to that nonprofit, so you can't take that money that you're contributing every month as a tax write-off. So that's just not going to work either. Now, there are some restrictions on age with who can join a HealthShare. It's perfect for ages 18 to 64. Kids can be on there with their parents, so it's not excluding kids, but they have to be with a primary member between the ages of 18 and 64. There is no medical underwriting required to join the HealthShare. We do accept everybody, and you can join very easily. Um, it's great for individuals. I've got a lot of individuals whose spouse is on Medicare and they're just waiting those years to go by until 65 and they jump over to Medicare. It's great for families, especially if you're a younger family and you want to grow your family. If you want to have a child, as long as you're a member 6 months, maternity will be shareable with the health share starting at $2,500. So you would pay $2,500 out of pocket for any type of childbirth or maternity need. And then entrepreneurs, you know, I really work with a lot of entrepreneurs, and I'm constantly telling them, hey, look, instead of paying for insurance and wasting that money that you've received through VC or angel funding or whatever, go get a health share. That's the most affordable thing you can find. And then from the health share, if the company continues to grow and then the company's like, hey, we want to go get insurance, go for it. But but in this early stages, when every dollar counts and you need every dollar to go toward, developing your MVP or taking your stuff to market, I would say join a health share. Be a part of a health share. It's going to be the best thing for you. And also with employers, for employers, there's no minimum participation requirements. So you could have one, two, or three, doesn't matter. It won't affect the rate on the membership with the health share. Health share memberships are always going to be the same and at an individual level. And so if an employee decides to leave or decides to go off on their own, they can keep the plan and just assume payment for their membership and continue to be a member of the health share. It's a great little tool as well. So how does it work, right? So the way it works is that a member chooses their IUA, and there's going to be some jargon here, but IUA stands for the initial unshareable amount. In that second bullet, it says you pay the initial unshareable amount. Now, what does that look like? So an example, I'm looking into a knee thing that I'm going through right now. So I paid for an MRI out of pocket. I paid for the initial doctor visit out of pocket, and whatever I need to pay up front would be my initial unshareable amount up to a certain number, and that number is going to be 1250. So $1,250 is my plan. So in 1250, once I hit the 1250 mark that I paid out of pocket, then the community would share in the rest, right? And I have to submit this medical need online through the portal, and then the community would share in the rest of the medical needs over that amount I've selected. So it's better than a deductible, and I'll explain why. As I mentioned earlier, most deductibles are 5,000 for an individual or 10,000 for a household. With HealthShare, you have a choice of choosing between three options. There's a 1250. Now you pay this once per medical need. So for example, with the knee that I'm talking about, you pay it once, and then anything beyond that is going to be shared with the HealthShare, and it's based on the medical needs. So that's all I have to pay. If I have another medical need, maybe I hurt my shoulder or have to go into surgery or something like that, I would be responsible for the first 1250 of that medical need. So it's really just it's based on your utilization. So if you use it, then you just pay the first 1250, and then the health share will step in and pay the rest, right? So you're not paying 5 or 10,000 out of pocket. You're paying only 1250 per medical need, and that's how that works. And um, so you pay it once per medical event. Anything related to that, follow-ups, therapy, whatever, it's also included. Now, the max of 3 IUAs per household, what does that mean? So that means that if in my house, I've got 6 of us, right? I've got 4 kids at home. And so if I have a medical need, my wife has a medical need, one of my kids has a medical need, that's 1, 2, and 3. I'm responsible for the first 1250 of those 3 medical needs. Now, let's say another kid has an issue, and that's number 4 in a 12-month window, right? The health share says, hey, Eric, you've already met your 3. That fourth, as long as it's over $500, is fully shareable with the community. They won't require an IUA from me. It's basically so my max out of pocket, the way I like to describe it, my max out of pocket in a 12-month period is going to be three of the 1250s, or 2,500, or 5,000. So these are other plans that you can choose. And why would somebody pick up 5,000 over a 1250? Well, it really depends on their situation. Maybe they've got more money saved up. Maybe they're like super healthy and they're like, I'm never going to use it. So that's kind of just some determining factors based on your situation that you can choose. But it's nice to have this as a even as a safety net for that at that amount. So what counts as a shareable need? So medical need requests, right? These are the type of things. So any type of emergency care, any type of accidents, falling off ladders, crashes on mountain bikes, you get hospitalized or you have surgeries, even maternity, as I mentioned earlier, serious illness, going to the hospital for any type of serious illness. All of those are medical needs, and you would submit a request for support with any of those medical needs. And of course, if it's life-threatening, you want to go in and take care of that. You don't want to hold off or and wait to submit a medical need. You just go take care of it and then come back and submit it to the health share. The health share will work with you on how much you've paid out of pocket, if any, and then how much they'll pay directly to the providers for. And so you want to make sure that you're taking care of your life and your health. So what's not shareable? This is interesting. Now, routine care, for example, um, there is an add-on you can add for an annual provider checkup, which would be couched as routine care that the healthcare would pay for. But in general, routine care is not going to be something that's shareable. Dental and vision is not going to be shareable. Elective procedures as well. What is shareable are things that are considered medically necessary, right? And then pre-membership conditions, these are things that existed prior to joining the health share. Typically, it's 24 months prior. If you have something that existed around that time before you join the health share, those have what we call a phase-in period or schedule, and so we can look at that right now. And so pre-membership conditions would be known also as pre-existing conditions, right? This is something that existed prior to you joining the health share. Um, those particular medical needs uh, would be isolated. So, for example, if I joined the health share and I had a shoulder injury before I joined the health share, this particular medical need would be subject to this phase-in period, right? That means that if I have a medical need related to my shoulder and I need to have surgery on it, first year would be a waiting period, right? I don't want to have a surgery in my first year membership at the health share because there's not going to be any dollars to share related to this need, right? This particular issue. Now, anything else happens, it's fully shareable, something new and unexpected, that's going to be shareable. But again, the pre-membership condition, shoulder in this case, $0 in the first year, 25K in the second year, 50 in the third, and then fourth year and on, they'll share up to $125,000 towards any type of surgery or medical need that you have that existed prior to your joining. So it does open up, and that's pretty fair. I think that's a great system there on pre-membership conditions and how to manage it. Now, I mentioned routine care, right? So routine care can be satisfied with a couple of things, right? So I mentioned a preventive care service, which includes an annual checkup. That's an add-on you can put into your membership at the health share and include that in, and then you can utilize that. And that gives you an annual checkup. But there is also something known as direct primary care, DPC. Now, DPC is a great solution if you have one in your locality, right? So, for example, I have a neighbor who's a DPC doctor, and he's looking for patients right now. So, if you're in St. George, let me know. But he basically works with his patients directly. The patients retain him on a monthly basis, and then he becomes their doctor. And anytime there's a need, you call him. You can take care of everything through him or her if it's a she, in your area or whatever. And so the DPC would handle that routine care. He would handle that. Now, if you had a major medical need, something that came up later, then you would want to talk to the health share. The health share would be that other piece of that puzzle to help cover a lot of the catastrophic costs related to a medical need. But now you have a doctor, you have the health share, you have the complete system basically. So that's it's a good solution to have. Now, this is the preventive care add-on that you can include in your HealthShare membership. And so what this does is it includes an annual provider visit up valued at $175 per member. Also, well child visits if you have little kids at home. There's also adult preventive screenings like colorectal cancer screenings, mammograms that are included after 6 months. And then uh, there is no IUA for these services, so you don't have to pay the 1250 or 2500 or 5000 to use these services. These are available to you without that, right? And so you want to take a look at that if that's something that interests you. Now we also have, and this is the one that I like more than anything, is the virtual care, right? And so you can get prescriptions, blood work orders, or anything you need through our virtual care provider. And this is an additional add-on as well to the health share. And I'm talking about these add-ons because we do have a membership that includes them all, but the one that I focus on is what's called the essential membership, and then you can add what you want back in, so you don't have to take everything up front. And so anyway, so this virtual care is on-demand providers, prescription refills, mental health options as well. So there's a lot of great services with this. Now, we also offer a prescription share program as well. So we have you can add this in if you are on an existing medication, then this might be something to look into, and because you can typically get your medications at a lot cheaper price um, this way as well. So. And then I mentioned maternity care. So maternity care has a few stipulations, right? So you have to be as member 6 months before conception. And then if you have a membership, and you know that there's a 1250, a 2500, and 5000. So typically it starts off at 2500 for a baby, and then if you have the 5000 membership, then it's 5000. Even if you have the 1250, it's still 2500 for a baby, just because there are some intense costs associated with that, right? But it also covers prenatal, delivery, postnatal, hospital, OB/GYN, C-section, and or home birth if that's something you want to do. Great. So now we're at a point where you can actually scan this QR code. Let me move something over here. There you go. Move that down a little. Then you can scan the QR code if you're interested in more information. But there's two membership types. There's the essential membership, meant for private organizations, organizations like mine, where you can come and you can join through my organization. It gives you the base level membership with the optional add-ons, right? So those three add-ons: the preventive care, which is the annual provider visit, virtual care, the telephone support, and the prescription benefit RX support or RX share program. Those can be added in for a small fee. So it's a little lower cost on the base, but there's also the direct membership. And so if you know you want all three of those, then the direct membership might be a better fit for you. You can go in and you can select that, and you'll just get everything included in your membership. So, and that's a great little solution there. So, and then again, just to recap why people choose a health share: lower monthly costs, and we can go over costs here in a minute. But for me and my family of six, I pay about 540. I think it just went up to 548 for my family, and so that's a great price, for our family of six. Um, Again, no annual lifetime caps. Uh, there's fast processing times, right? So within 5 to 8 business days typically is what they're looking at for processing of payments and all that stuff to the providers. And what's nice is they pay direct to providers, so you're not like left holding the bag waiting for reimbursement. You only have to pay your first 1250 or 2500 or 5000, and then the health share will pay directly to the provider. So it's really nice, right? And then it's community based, of course. That's the other piece. And then a few quick FAQs. So is health share the same as insurance? The answer is no. It's not the same as insurance. It's very different and distinct. We don't want to look or act like insurance. We don't want to be regulated like insurance. So we do our best to stay away from even looking like them. Is it ACA compliant? The answer to that is no, it's not ACA compliant. So if you need an ACA compliant plan, maybe you're looking to open an HSA account, or something like that, then HealthShare isn't going to help you with the ACA. There are other options out there. Even on my website, if you go to whatishealthcare.com, I do have some other options for those who want an ACA compliant plan or a HealthShare plan. If you're a business, we have ways to get HSAs for your employees and still have the HealthShare. So that's another good thing. How fast are these processed? Typically 5 to 8 business days. Do I still pay out of pocket? Yes, so you do still pay out of pocket, right? So you pay the first $1,250, or you pay the first $2,500 or $5,000 out of pocket. However, it's broken up, right? Just peanut butter across all the different services until you get to that number. And then as I'm going through, so for example, I'm going through and as I'm getting itemized bills and receipts for payment on these things, I take them and I submit them to the HealthShare and make sure that they have that. And then as soon as I hit my number of 1250, then the HealthShare says, hey, great, anything else that comes up, please let us know and we'll make direct payments for those things. And then does it replace insurance? I would venture to say yes, although that for a lot of people, leaving insurance is a little scary. It's kind of like being an entrepreneur and you're starting your own business, going out into the world on your own, providing value on your own. There's some intimidation there, or trepidation, and leaving insurance altogether feels like that. But with HealthShare and a whole team that's there to support you and you can communicate with about medical needs and a telehealth app, all of that kind of goes away. So you can be able to have that support and that network to help you, go through medical expenses and be a better consumer of medical needs. Right? And does this work outside the US? The answer to that is yes. If you're out and abroad traveling and you have a residence here in the US and you're just away for a little while and something happens overseas, then yes. Most likely though, it would be more of a reimbursement type model because my guess is the hospital that wherever you are is probably going to want payment immediately or as fast as possible. And then you just submit those itemized bills in English to the HealthShare and they typically will reimburse you the costs associated with that. So if you're ready to create real healthcare freedom, then I would say visit me at whatishealthcare.com. Here's another QR code you can click on or scan with your phone and it'll take you right to the website. And that should give you more information, access to information. And so just want to say a big thank you for being a part of your presentation today, helping me figure out this whole live stream thing. And hopefully this will be on the internet for a while and others can learn from it. But I did promise that I would take a look at some pricing. So let me go ahead and get that ready real quick. And just give me 1 second here. Pull it up. Here we go. All right, hopefully this is the screen that we can see. Find out. Okay, yeah, that's the one. All right, great. So this is whatishealthcare.com, better answers, better healthcare choices. Under HealthShare, you'll see details and pricing. If you click here on details and pricing, then what it does is it comes up with the side-by-side look at the memberships. I have a presentation you can watch in there. But if we just look at pricing, the HealthShare of choice, Zion HealthShare, by far, hands down, the best rated HealthShare on the market right now. They have grown leaps and bounds over the last, however many years since 2019 when they opened their doors. Best customer service you could possibly imagine. That's one of the reasons I stay with them is because of their customer service ratings. Just absolutely amazing. Now, here are the pricing. So we've got on the left side, we've got our direct membership, which includes all those services. For me and my family at age 49, I would be $717 if I had all the services. Right now, I have the essential membership at $544 with the telehealth, which is I think another $15 on top of that. So $544, so about yes, it's 75. So and that's what I pay for my family. So when I turn 50, which is this year, crazy to think. I'm probably going to jump down to 2,500 just so I keep my number in the 579 range. But what's nice is you can actually kind of play around with this. You can only adjust these every year, and I've been a member for long enough that they're not gonna, get mad at me if I decide to change IUA amounts, this next year or whenever. But so the pricing is pretty reasonable. So for example, if you're a single person and you're 18 to 29, entrepreneur, hardworking, never gonna get sick ever, but you need a safety net, 18, so right here, $84 is what it would cost you per month to have the essential membership as a safety net, and then $5 if you want virtual care. That's a doctor in your pocket, right? And then they're there to coordinate any kind of care you need. Now, if I'm, maybe older, my husband's already on Medicare. It's just me. I would say I'd probably do like a 2,500 IUA. That's 236 a month. It's pretty reasonable. If I wanted to do a 5,000 IUA, it's 165 a month. I mean, you can't beat that, right? At that age bracket, 50 to 64. And then add some of these other services in, like the, preventive care for your screenings, things like that. Virtual care, also a good benefit to have. So these are all great, and I think people should start learning more about HealthShare. I also have a click to register right here. Now, why do I use HealthShare, and why should you use our website and register through us? Well, so I basically am self-employed, and I take care of my family, and there's some information here. I think, well, maybe not. I thought I had some information here about. Oh yeah, here's about us, right? So you'll see a little picture of me and my family. This is a few years back. We were traveling through Georgia, beautiful place, so we've been doing this for years. I've got, kids are now a lot bigger. They're taller than me now, so I got to update this picture, but my girls are getting tall. But anyway, so this is my why. This is why I do this, and it helps us do our homeschooling. It helps us do all of our activities to help our kids learn and grow. So this is really why I do this. And so if you utilize our website or our link, then all it does is it tells Zion HealthShare, hey, this is Eric, and he's been the one to help introduce people to this service, and yes, I do get a small compensation back. It's not hardly enough for even an insurance agent to want to sell this stuff, but I've got great numbers, and lots of friends who've supported us and joined through us, and so yeah, if you do us the favor, when you're ready to sign up, just go here and under HealthShare and say get started here. Click there. That'll take you right to the Zion HealthShare sign up page. You just fill out the page, create your account. Once you've created your account, you have to check your email and make sure you do that within 24 hours because the link does expire. That'll basically confirm that your email is correct, and then log back in. Once you log back in, you'll see something similar to this, and let me go over here and just show you. Um, you'll have a page with about 7 steps on it, and what you'll do is you're going to select your start date. So this is called the effective date. So you want to select your effective date. I'm going to pick the 31st, and then as you go through, you'll ask for your mailing information. It'll ask for any additional household members. And then it'll say, oh, well, here's the membership options. And then you can select between direct and essential. And based on your household, it will automatically adjust all these rates for you. These are the additional services. You can select that or not select that and select that one. And then it'll update your numbers accordingly. Um, and, uh, and so, yeah, so that's very simple, very easy to do, quick, doesn't require any type of disclosures. I mean, you don't have to be screened or anything like that to join. We do take everybody. And then it goes through kind of a lot of what we talked about, some of the pre-membership medical condition phasing period, things like that. And then you get to sign your name, and then you hit clear, go ahead and hit next or whatever. And anyway, so it's very simple, easy to do. Now, if any other questions come up, anything else that you want to know or learn about, you can schedule a call with me right here, and it will let you see my calendar or peek into my calendar, and you can pick a time or a day that works best for you. And so anyway, I am glad to be here of service, glad to help you out and help you understand what HealthShare is and how it works and all of that fun stuff. And so if you have any questions, please reach out. me know how I can help. And yeah, so yeah, this is good. Well, okay, so thank you again. Thanks for being with me, and I look forward to seeing you out there. And again, if you have any questions, feel free to reach out. Okay, everybody, thanks. Take care. Have a great rest of your day and a great rest of your week.